Hello, my name is Daniel Woods, Principal Agent with TWI Insurance Group and Associates. Today, I would like to tell you about new approved healthcare options based on recent, current, and ongoing changes in healthcare. So let's get started. This brief presentation is to provide details about healthcare solutions from North American health plans. These comprehensive plans are currently approved as ACA or Obamacare plans and are structured to fit the mold of the upcoming changes in healthcare, which may be considered Trump care. The thing that I want to point out about these plans is that they are ACA approved, which means you will meet the government requirement of having credible coverage and you will not get a tax penalty for not having credible coverage. So, at tax season, you will receive IRS tax form 1095 showing that you did have credible coverage. Customers can have customized plans. One of the biggest complaints that I hear from people who consider themselves to be healthy is that they feel they are being forced to pay for coverage that they do not need. I mean, why should a 50-year-old couple with children in college have to pay for maternity or prenatal coverage? Well, these plans allow for the election or rejection of various fixed benefit options based on specific choice. Now, these plans also cost way less than the current healthcare plans that many are paying for now. These plans can be purchased year-round, so no waiting until open enrollment and being stuck with the decision for the rest of the year. If you find a plan at a price that you like, you can change now. Also, lower deductibles. Actually, in most cases, there is no deductible at all, and this is to do with the nature of how the fixed benefit options work. So, how does this work? These plans are designed in three parts. Part one is the MEC. Now, this is considered minimum essential coverage. Part two are the fixed benefit plans and plan options. And part three is the fully insured comprehensive prescription plan. The foundation of the North American plan solution is the MEC, and this is provided through a company called WellMec. So as I stated before, the MEC in this case stands for minimum essential coverage. This is what is required by the government as it relates to approved credible coverage. So the plan from WellMec is what meets this requirement. So what does the MEC cover? Well, it covers the basics: annual physicals and well-woman visits, wellness screenings including for cancer, cholesterol, heart diabetes, hearing loss, vaccinations including flu shots, hepatitis A and B, tetanus, and child immunizations, also counseling services for healthy diet, tobacco, behavior, obesity, alcohol abuse, and domestic violence. So here's the best illustration of the concept. Once you have the MEC in force, then we begin to add the other pieces around the MEC to provide a comprehensive health coverage. The second critical piece of the North American Health Plan option is a suite of fixed benefits provided by Manhattan Life. These fixed benefits plans are specifically designed to fit into the North American plan solution. Now, the last piece is the selection of a prescription plan option, and this is based on your specific needs. Okay, so here is a product comparison. On the left, we see a national healthcare provider with a male age 49, a female age 43, and two children, one age 15, the other age 17. The first thing that we notice here is that the family deductible is $11,000. The next thing to point out is the out-of-pocket max of $13,700. And the final thing, of course, is the most important, which is the monthly premium of $1,500 per month. Now, if we look to the right, we see the same male, age 49, with his wife, 43, also the two kids, 15 and 17. So we have the MEC, which is the basic, which keeps you from being penalized and makes this a government-approved plan. Then we also have the fixed benefit plan. Now, on this particular case, we've even added cancer, accident and disability, dental and vision, and life insurance and critical illness. Even with all of those added, the total monthly premium comes to be $922.27. So here we see, even with all of the fixed benefit options on the North American Health Plan side, we still see a savings of $577 a month, and this is with no deductible. Now, this is who this may be a best fit for. Anyone who considers themselves to be healthy and feel like they're paying too much for health insurance. Anyone who is paying for their own health insurance, who is not currently receiving a tax credit, and who wants to have lower monthly premiums. Anyone who is paying for their own health insurance and not receiving a tax credit, who wants to have coverage tailored to their specific need. And lastly, anyone who is paying for their own health insurance and not currently receiving a tax credit and who wants to have lower deductibles. Now, this is who this may not be a good fit for. Anyone who currently has a pre-existing condition that requires current and immediate care. Also, anyone who is currently receiving a large tax credit to pay for their current health insurance. Now, if you want to get a quote and either enroll, you can go to our site at twiains.com, go to the submissions page, and then click on the tab that says Get New Healthcare Law Quote, and complete the quote and or enroll. Now, if you have more questions, which most people do, you can email me at daniel3@twiagroup.com. Or if you want to give me a call, the best number to reach me is area code 678-940-3713. I look forward to speaking with you soon, and thanks for your time. Take care.